Hi everybody, this is Dr. Ty Vincent with another low-dose immunotherapy-centered video. This one based on requests from several people who have seen other videos to talk about something called cholinergic urticaria. If you don't know what that is, then you don't have it. If you did have it, it sucks. It makes your life very, very difficult and miserable, and there's no known really effective treatment or management. And you would have probably looked it up on the internet and researched it, and you'd know exactly what I'm talking about. But I'll describe it somewhat because you may know somebody who it sounds familiar, you think that has it, that you know and care about, and maybe you can tell them to watch this video too. So urticaria basically means hives, essentially, except big hives that often can kind of coalesce together into larger blobs of hives and be amorphous. Instead of, if people have hives, they think about these individual little tiny kind of bumps like mosquito bites here and there that are red and itchy. But urticaria, though it technically includes the hive reaction, hives are a form of urticaria, often people with these reactions have much larger, swollen, itchy lesions and spots. They move around the body in many cases, can be kind of random. Or in the case of cholinergic urticaria, that sort of means, by definition, that your urticarial lesions, your giant hives, are elicited through something that stimulates the parasympathetic nervous system, which excretes acetylcholine, okay, as a neurotransmitter, hence cholinergic. And that can include eating. So eating and digestion, the peristaltic movement of the digestive tract on the way through, is mediated by the parasympathetic nervous system, and all of those small, smooth muscle contractions in the gut utilize acetylcholine as the neurotransmitter. Something else that uses acetylcholine as the neurotransmitter is sweating. So the sweat glands in your skin utilize acetylcholine as the neurotransmitter, and what's called a muscarinic acetylcholine receptor, like the muscarinic receptors that are on your smooth muscle in your intestinal tract and whatnot. So exercising or exerting yourself to the point of sweating may trigger urticaria in people with cholinergic urticaria, which is lame. Any temperature change that they experience, so like going from an air-conditioned room outside when it's 85, 90 degrees, that might be enough to elicit this urticarial response because your sympathetic and parasympathetic nervous systems are involved in temperature regulation and the dilation or constriction of blood vessels in your skin, and also sweating, things like that. So people with cholinergic urticaria will have a lot of potential triggers, just the act of eating and digesting things. Any kind of sort of emotional stress response can do it for some of them that would make you flush under normal, so like blushing, like boom, there it sets off an urticaria reaction, or exercise or exertion of whatever type, or just change of temperature, like you get out of the shower and step out and you get this cool air on your wet skin and bang, you get hives, right? So it's really unpleasant to live like that. Because there's a cholinergic trigger for this, oftentimes your regular antihistamines and other allergy drugs don't work very well for cholinergic urticaria. That's often why it starts to be suspected as a diagnosis, because you don't respond to antihistamines the way you would expect somebody with routine hives to do. But then through further questioning and investigation, you identify these people, this subset of reactive people, as cholinergic based on some of these other triggers and phenomena that they know associate with their outbreaks. Some people will get what's called angioedema, which is where like a kind of a whole piece of tissue seems to swell, commonly in the lips or the face or some other place, where it's more of like a big regional swelling, and it isn't just the skin necessarily, but the deep tissues as well. So that's kind of what we're dealing with this problem. There are thousands of people in the country that have it, but it's still not very common, right? Hives and allergic reactions in general are very common. And people nowadays who have a lot of different allergies, or their allergies have gone on for longer and longer and longer, can end up with more and more sensitivity to their system in general. And they can start experiencing triggers just from mechanical processes like eating and digesting, or from scratching on their skin, or from temperature changes or whatever. So this kind of more extreme manifestation of an allergic type of response is becoming increasingly common, whether you meet the strict criteria for cholinergic urticaria or you just seem to have unexplained chronic hives. to me isn't really important. That's actually not an important distinction in treating these people. Just having this cholinergic kind of manifestation means that your autonomic nervous system became involved and is an integral piece of the end stage reaction patterns that you experience. But just like people with mast cell seeming symptoms or people with just widespread allergies, it usually starts with some kind of more mundane, typical kind of allergic response pattern that you may have had in the past. So when I get a hold of people that have any one of these end stage kind of conditions that involve hives, urticaria, or lots of immune reactions, I always want to know about the beginnings. What did you have as a child? What did you have in your past? Did you have hay fever? Were you allergic to dogs? Did you have asthma? Did you have eczema as a kid? Did you get hives through your teenage years and nobody ever figured out why? What was going on at the beginning? And oftentimes, if we can identify what some of the triggering items were at the beginning of this process, that's frequently still what the ultimate category of trigger is for you now. So it's always important to dig back historically and try to find out, well, what do we know used to be a more discrete trigger for you? And we start there. That's not always where you end up, and it's not always the whole answer for people. Sometimes over time, their immune system has begun to react to more than one thing and more than one category of things. So you may have started out allergic to grass and pollen, and then you started reacting to certain foods, and then you started to react to the yeast that lives in your gut, which is there all the time. And so now your allergic reactions appear to go off all the time, no matter what you eat, no matter what you're exposed to. And so if I treat the person who's gotten to that stage, I have to desensitize them to airborne allergens, food allergens, and yeast, right? Sometimes you start to react to other different kinds of bacteria, especially if you have the angioedema kind of picture that can happen. That's often a bacterial kind of reaction because it involves the system in your immune system response called complement, the complement activation system, which is primarily devoted to bacterial reactions. But that's kind of an esoteric point. So anyway, when I get a hold of the people with cholinergic urticaria and similar kind of really broad immune reaction patterns now, there are a lot of questions I have to ask people. I have to try to put the pieces together and see which things seem most likely in your case. What kinds of allergic reactions do we know you have had in the past? Maybe start there. When it evolved into something more comprehensive and worse of your reaction pattern, what was going on around that time? What were some of the catalytic events and factors that might clue me into somebody now reacting to yeast, or now reacting to some parasite that lives in the gut, or some new thing that set them off in that path at the time that it happened? So the point there, which I also made in my mast cell activation video that we made not too long ago, is that focusing on what your symptoms are like today isn't helpful. Actually, we have to. That's going to look the same for all these people, no matter what their triggering antigens are. So we have to do all this questioning and detective work and think back to what do we know you used to react to, what were the factors that evolved it in this direction, and how can we sort out what the most likely things to try might be. And then we go through all the different antigen suspects systematically, one by one by one by one, and find out which ones are relevant and which ones aren't. And this can be done. Sometimes it can be done very quickly and easily, which is largely luck. Oh, you try the food mixture first and look, it all went away. Great. That makes it look easy. Sometimes you try the food mixture and only gets halfway better. And then you try adding, the environmental mixture and it gets another 20% better. And then you try the yeast mixture and now it's all better. Or you use some other microorganism or chemicals. That's another thing that can set this off for people over time is chemical sensitivities. We have a mixture for those too. So if you're suffering with this problem, there is definitely a chance of you getting better and getting rid of it. In fact, managing it constantly and asymptomatically long-term with LDI or some other desensitization strategy. So it's something to look into further and pursue if you're suffering from cholinergic urticaria or a similar problem. Thanks.